bacterial infection in the mouth, including abscesses, but also ulcers, even though it may be so bacterial related, fall into this category. So, Notikeel is our bacterial remedy. And then we haven't talked about arthrochelan A, or it's also called Art A. It is a remedy that is for bone degeneration. So in general, it's a bone degeneration remedy, but then very specifically as an application in the mouth, any bone conditions of the jaw, it will be useful as a remedy. Pretty much everything else falls into the pefferkeel category. Now, if you remember, very early on we talked about pefferkeel as the remedy for mycosis or fungus when it's first entering orifices. So the mouth is this entrance orifice, and so this is where pefferkeel parcillosis has a tendency to hang out. And so anything to do with the gums or the gingiva has an affiliation and association with that. And then also root canals or troublesome teeth. Those teeth that patients describe as a niggly pain, or the dentist is saying that it's a candidate to become a root canal. These are the types of things you would use pefferkeel for. Gum pockets are another one. With the gum pockets, by treating, you'll find that the millimeter size actually decreases. And within a week, you can decrease it by 3 millimeters, which is actually huge for gum pockets. So what you're doing, again, remember, we're addressing the milieu and the terrain. We're changing it, and so pathogenic microorganisms are not able to hang out there anymore, and then things can regenerate. The gums and the gingiva can start to regenerate. So what you do is you take a knife and heat it up. So just even under some hot water. And then with the hot knife, because it's coconut oil, you can actually slice through it. Otherwise, when you're trying to cut through it, it kind of crumbles everywhere. And so pretend it's a sausage, slice it up into many slices, and then use a quarter to a third of that full suppository and pack the affected area, before bed. So have the patient just pack that area before bed. What's going to happen is the warmth and the heat in the mouth is going to slowly dissolve it, and it's going to end up being kind of almost like a slow drip of healthy physiological microorganisms to that area of the mouth. And so many potential root canal teeth have been saved by just changing the terrain and the milieu. You can put the drops in the mouth. That's definitely going to work, but basically what happens is they'll get swallowed. So the next best option, if you're not using a suppository, is to just soak some drops on some cotton or some gauze, and then just pack the area. So at least you have those microorganisms in that area for a longer period of time. If somebody is having a lot of dental issues or a lot of issues in the mouth, then consider changing the terrain in there as well, or the milieu. Ask them to be brushing with baking soda, or they could use like an alcala or an alkalizing powder, and then just every evening to be brushing with that. You're changing the terrain and you're down-regulating the pathological microorganisms in there. When you're looking at mucorrhesmosis, in its pathological upregulated part, one of the things that kind of morphs into or is kind of changing is Leptotrichia buccalis, which is one of the bacterial phases. And often what you find in root canal teeth is Leptotrichia buccalis. And so often then it's a real easy solution. Change the terrain back, get these down regulated, and then you're not going to have these as issues any longer. Interestingly enough, the Leptotrichia buccalis has also been positively identified with cardiac afflictions. And in a root canal tooth, you're getting that slow drip into the bloodstream. And so I know Dr. Slagle has a number of positive cases that have had extreme success treatment by dealing kind of with the Leptotrichia buccalis and improving the heart conditions as well.